My initial perceptions of IG-SRT is that it was great technology and that it'd be really good to add that to my practice to give my patients that option.
When patients come into my office and we have confirmed that they have a skin cancer, I want to give them a choice. Having IG-SRT in my office is another tool in my toolbox.
Some of these patients that undergo IG-SRT are patients that have had multiple surgeries. They are looking for alternatives, and when we present them with this, they don't even realize it's out there sometimes. It's like a breath of fresh air. Oh my gosh, I don't have to be cut on again.
Most of my patients would have had a much bigger, much more difficult treatment had they gone surgically. The radiotherapy can treat very large lesions in virtually a painless manner.
As a Mohs surgeon who also does image-guided SRT, if you want to compare the efficacy of each, I find them very similar. But also as a Mohs surgeon, you walk in a room and there's some cases you don't want to surgically tackle. And that's where it's great to have an alternative option like image-guided SRT to handle some of these larger cases on elderly patients.
We've had people who are 90 years old that have heart problems, on multiple medications. They don't want to go and have surgery somewhere 30 miles away. They really, really appreciate it more than, I was surprised how much they appreciate it. I mean, there's no pain, there's no cutting. It's worked out very well for patients, and it's worked out well for me as well.
When I talk to my patients about IG-SRT, they usually have not heard about it. So they're very intrigued and interested, and when I tell them especially that it's non-invasive, very effective, gives them great cosmetic outcomes, they're usually very excited.
When bringing up IG-SRT as a treatment option, most patients balk at the idea of 20 treatments plus a follow-up. But once they get going and they realize how simple and easy it is, the time flies by, and before they know it, they're done.
I know that IG-SRT has benefited my patients. I can tell it because patients are happy. The biggest complaint is, hey, why didn't you do this before? What took you so long to incorporate this into your office?
The fact that patients are able to visualize the skin cancers basically gives them some reassurance that they're responding appropriately. It gives the physician reassurance, the radiotherapist reassurance, and most importantly, the patient is able to see the cancer responding to the treatments, which is a motivator. We chose IG-SRT because of GentleCure. Setting it up was almost like a magic show. They came in, they basically remodeled the space. Literally, you'd leave on Friday afternoon and you'd come back on Monday and you had a SRT room in place, ready to go.
GentleCure essentially did all the work for me to put this into my practice. They made it financially feasible. They took care of state regulations, Medicare regulations. They provided a radiation technologist for me.
One of the benefits of partnering with GentleCure Oncology is that they hire a radiotherapist to help or basically run the device for you to free you up to see your regular patients.
When they choose IG-SRT, I submit that to my other GentleCure Oncology team members so we get the insurance approval for the practice. I also schedule all of the appointments for the patients. The practice does not have to worry about that at all.
By offering the image-guided SRT here in the office, I'm not referring these patients that would otherwise need radiation to treat their large skin cancers to the hospital where they may be lost to follow-up. It's all done here.
The ability to perform superficial radiation therapy has increased the business in my office. I get phone calls from people up to 50 miles away wanting to come in and have the procedure done.
Patients want choices, and the more choices that they have, the more likely that they're going to recommend other people to your practice, the more that they're going to come to your practice and they're going to be a long-term patient.